Hello friends, I'm Dr. Gaurav Khera. I'm a senior consultant in orthopedics, joint replacement and spine. So today we will be talking about spine surgery. The topic we're going to be covering in spine surgery is basically lumbar canal stenosis. Now what is lumbar canal stenosis? The spine has 31 spinal segments. That means it has 31 pieces of bone which are put together to form your spinal cord. There are 7 in your neck, which are called the cervical vertebra. There are 12 in your chest, which are called the thoracic vertebra, and there are 5 lower down in the lower back, which are called the lumbar vertebra. Then you have the sacrum and you have the coccyx. Now, the most common place where we get stenosis is the lumbar part of the spine, and this is called lumbar canal stenosis. How patients are going to be presenting with lumbar canal stenosis is the most common presentation is back pain, which is radiating down to both the legs. The patient come with excruciating pain, numbness. They can also have difficulty in urination. They can have retention of motion. The investigation that we normally do is an MRI, and it is confirmed on an MRI. Now, when we see the vertebra, there is a column through which the spinal cord and the nerves are traveling. So when there is a tightening of this column, this is called stenosis. Now, as the tightening occurs, the nerve, it gets pinched, and that causes the pain to radiate down into the leg. The causes of this can be many. It can be because of arthritis, it can be because of normal degeneration of the spine, it can be because of a disc which has prolapsed into the canal. And the treatment of a lumbar canal stenosis is generally, we try to manage the patient with conservative means like physiotherapy. We can give steroids, we can give painkillers, we can give a few other agents to smoothen the nerve out. But if none of these work, then we have to go in for a surgery. Now, what all do we do in the surgery? Basically, we have to first see that what is the cause of the stenosis. If it is just a disc that is really herniated out and which is causing some compression, so we can go in for a discectomy. This discectomy, initially about 10 years back, was always an open surgery. But now, as times have changed, we are doing minimally invasive surgeries. We are also doing arthroscopic discectomies. And if it is something else, if it is like there is an arthritic change or if there is a bony structural change, then we have to go in for surgeries like laminectomies. We could be doing fixations, and we could be doing fusion of the entire segment. Now, what is a fixation? What is a fusion? Basically, every time if we are taking out the lamina of more than two segments, then we have to fix those segments, because then they become unstable. We fix them with screws. And if we do more than 3 segments, that is 3 vertebrae, then we have to fuse it. Okay. When do we decide that now we cannot continue with conservative management? If there is any sensory loss which is occurring, which is not getting recovered, if there is any motor loss means that the power of your muscle starts to go down. If there's any urine retention that occurs, if there's any bowel retention that is occurring, then you have to go in for a surgery. We do not have any other option. When the patients say that the leg pain is more excruciating than the back pain, again, that is one reason when we really decide to go in for a surgery. Or on the MRI, we see that the disc is very big, or the stenosis is severe, that is, it is less than 9 millimeters, then we have to go in for a surgery. Now, it is a very safe surgery. It is not as bad as generally patients, when they come to me, they are really dreading a spine surgery, because they think that once the spine is operated, they will never be able to move around. It is not like that. It is a very safe surgery. It is a tried and tested procedure which has evolved over the years. The rate of complication has come down. The equipment that we are using is state of the art, and because of this, it has now become a very smooth process. So what all we do on the day of the surgery is that we prep you, we prepare your spine, we give you a pre-anesthetic medication, you are operated. We will be making you walk within 48 hours of the surgery. You will be taking time to recover. You will not be able to do all your activities for at least 2 to 3 months. But once you completely recover, and once if we are doing a bigger segment fusion, Then once the entire fusion takes place, then you can be doing all your activities. Uh, Complications, yes, there are a few complications that can be associated with this, the most common being infection. The other complication can be nerve damage. The third complication can be that even after the surgery, there is some radicular pain that continues. That is because every time, we are operating, we are handling the nerve root. So if the nerve root gets irritated, it can continue to pain even after the surgery. But this does tend to settle down in about 2 months' time. Um, the safety involved, if you like, the most common question that I'm asked as a surgeon is that will my legs work after the surgery? It is as I said, we do not have to worry about such things because these are complications which do not really happen anymore. And I would like to end this by saying that if you are suffering from any of these symptoms, like severe back pain radiating down to your legs, or numbness, tingling of your legs, any weakness in your legs, then you should start considering to get yourself checked and treated. If a surgery is required, you should consider surgery. You could meet me at RLKC Metro Hospital, Apollo Spectra Hospital, or at my clinic at Dr. Khera's Wellness Clinic at Indupuri. You can also text me, you can get me through video chat, or you can contact me on Lybrate.